nose, my throat, like, because you can't be there when I'm sleeping at night. How do you figure it out? How do you get to the root cause of that?
Funny enough, sometimes people will take little videos of themselves at night, and that can really help me with determining that. That happens more with kids, so a parent takes a short video of their 4-year-old sleeping, but that's just one thing where it's like, I'm not with you at night, but I got a little workaround. So thank you, technology. But for really figuring out where your snoring's coming from, it's all about physical exam. And sometimes we have to do the next step where we do a drug-induced sleep endoscopy. Basically, breaking that down, we do a light anesthetic and induce a sleep-like state. And then with a camera, I can go through your nose and look to see where collapse is happening. But way before we get to that step, I have to do a physical exam. I gotta look in your nose. I gotta see what's going on. I gotta look in your mouth. I can tell you just on a physical exam how big your tonsils are, how big your tongue is, if you have a narrow mouth. There are some people who have small jaws, and because their mandible is small, there's no room for their tongue, and that's part of their issue. Or maybe they have other dental issues, and I need to direct them to an orthodontist or someone, a dental physician or a dental provider. And then looking in someone's nose to see if it's coming from their sinuses, a deviated septum or enlarged turbinates. Turbinates are in your nose. They filter heat, humidify the air you breathe, and they can get big. They're what get big when you have a cold or allergy problems and cause you have trouble breathing through your nose. So if those are causing obstruction, I can usually see that on exam. And if it's something like that, we can start some nasal medications and see if that helps you breathe better through your nose and if that's enough to help you stop snoring. Or if your tonsils are huge and hey, let's see if it's time to get those out of there. Or again, like I mentioned, with a small jaw. And if there's nothing obvious on physical exam, sometimes in that same clinic visit, then I use a camera called an endoscope, where I'd go through the nose and then look at the back of the throat and see what areas are narrow, even when you're awake. Sometimes even when you're awake, and get, oh, this is where your problem is. Or then we might go to that next step of that sleep endoscopy. And then try to do very targeted treatment surgically for what problem areas there are. Of course, we're always going to start with conservative measures. If there are the medications like I mentioned for the nose that can help you, or say you've gained a lot of weight recently, maybe we just need to get you into someone who can more help you with your weight management, and losing that weight can be enough to help you stop snoring. But of course, not every patient is in that category. I have plenty of patients who snore whose BMI is 20. You know, that's not why they're snoring. It's not their weight. So, but making sure that those modifiable factors are addressed before we go down the surgery road. And then going down the surgery road, well, I guess I should say too, you have to get a sleep study in there somewhere like you already did. And there are some people who try CPAP strictly not for sleep apnea, but they do the CPAP just to treat their snoring. That does happen. That's an exception, not the general rule, but it is a non-surgical option to treat snoring. And then other things that are non-surgical to treat snoring are oral appliances, which is more of a dentist or a oral surgeon type question, a little outside of my field, but something that can be done where those oral appliances bring your jaw forward to open up the back of your throat and can treat snoring that way. And then moving back to the surgery options, really targeted treatment. If you have sinus and nasal issues, sometimes you need your septum straightened out. Sometimes, in addition to not breathing through your nose, you're having frequent sinus infections, or you just always feel like you have a sinus infection. And then we figure out what's going on with, say, a CAT scan or a CT scan, and then treat that. And then with the endoscopy, where I look for with the narrow areas, if it's your palate, there's surgeries I can do of your palate to help open up the area behind your palate, or surgeries to bring forward the back of your tongue if that's where you're having your collapse.